The tool used to perform a 7-site skinfold is a caliper. Proper training and ample technique is necessary to obtain accurate measurements. The accuracy when predicting body fat using the Skinfold test is plus or minus 3.5%, assuming the proper technique is used. Ensure the caliper is properly calibrated as it can lead into inaccurate measurements. Factors that lead into inaccurate measurements are poor technique, inexperienced evaluator, and measuring an extremely lean or obese subject. The 7 sites are the tricep, subscapular, chest or pectoral, mid-axillary, abdominal, suprailiac, and thigh. All measurements must be taken on the right side of the body with the subject standing upright. Before measuring the 7 sites, mark the body with an X in order to measure each site accurately. The first site is the tricep. The measurement should be taken from the midpoint between the acromion and the cranium process. It should be taken as a vertical fold. Be sure the caliper is placed 1 centimeter away from the thumb and finger. The pinch should be maintained for 1 to 2 seconds. The next site is the subscapular. It should be taken 1 to 2 centimeters below the barrier angular of the scapular. This will also be a diagonal fold. Make sure to squeeze and jiggle the skin in order to get all fat and not muscle. The next site is the chest for women and pectoral for men. When measuring the chest, the measurement should be taken 1/3 the distance between the anterior axillary line and the nipple. When doing the measurements on a male, it should take half the distance between the anterior axillary line and the nipple. This is also a diagonal fold. The next site is a mid-axillary. It could be taken just below a woman's sports bra, and this is the vertical fold. The next site is the abdominal. It is measured 2 centimeters away from the right side of the umbilicus. This is a vertical fold. The next site is the suprailiac. When measuring this site, the measurement has to be in line with the natural angle of the iliac crest. It is taken in the anterior axillary line superior to the iliac crest, and it is a diagonal fold. The last site is the thigh. The measurement should be taken at the midway point between the proximal border of the patella. This is taken as a vertical fold. You want to take at least 3 measurements at each side in order to make sure that each measurement is at least 1 to 2 millimeters in range of each other. Make sure to rotate the sites to allow the skin to regain normal texture and thickness. Once all measurements for the sites are obtained, use the following formulas to calculate bone density and body fat percentage. These are the formulas for men and for women. For men, plug in the sum of the 7 site Skinfold sites and the age of the subject. For females, use a specific formula to calculate their body density. Plug in the sum of the 7 Skinfold and their age. Next, using either the Brozek equation or the Seary equation, plug in the subject's bone density to obtain body fat percentage.